You can start.
Right. So, very good evening to everyone, and thank you for joining for this quiz session today. I believe we have about close to 150 to 200 people who have joined, but since a lot more have registered, we'll wait for 5 minutes more to start the trial run. In the trial run, I'll take you through exactly what we will do in the actual quiz. The trial run will not take long time, but I think we can wait for 5 minutes before we get started. So I'll wait for 5 minutes till we get more people to join. Right. So for those who have joined now, I think just tell again that we are still waiting for others to join. I'll go through all these rules in detail, but I'll wait for another maybe 4 or 5 minutes more before we can join. Tech team, how many people have joined so far?
The 146.
Sure, great. Thank you. So I think it's time to get started, and we'll start with the trial run of our quiz, which should not take you very long, and then we'll go on to the main quiz. I'm sure that you've already received all our rules and regulations and the details of the rounds, but nevertheless, even if you haven't seen them, no worries. We will go through it now in detail during the trial session. So I would start sharing my screen right now, and we would then start with the rules and regulations of the quiz that we have today. So this is just the trial round, so no worries. What we need during the quizzes, apart from the screen where you're watching me right now, you need to have another smart device where you can log in either with the help of a barcode or the code that you will get on each and every slide, where you can go to menti.com and enter the code and you can join the quiz. So I will go through all of those rules again, and I think this is the big list of rules. What you need is good internet, because if you have good internet, then definitely you'll be able to listen to me carefully. Nevertheless, the internet should be very good in the device that you're using, in addition to where you're watching me right now through Zoom, because that's the device that is going to capture your answers. The crux of the quiz is not only to answer the correct questions, but also answer them really, really fast. Because even if two of you answer absolutely correct, absolutely at the same time in seconds, but even in milliseconds, who's answered that fast will get more points. So it is just not the right answer, it is the right answer which is also correct. That's the first rule. Each question has a time limit. There are two different types of questions. Some require typing of the answer, some are just multiple choice questions. So depending on that, there are 15 seconds often given for a short multiple choice question, whereas 30 seconds where you have to type the answer. So please remember, there's a specific time limit. The timer will be visible on the screen for each question, and if the time is lapsed, you will not be able to answer. So you have to make an attempt. However, I'd like to ease out a little bit by saying that there is no negative marking. So if you have no clue, still you can take a guess, but do it fast, because if you're correct, you get more points. You cannot answer the question twice. So if you've already answered and later you realize that the correct answer was something else, that will not help you, because if you've already answered once, you cannot answer the question twice. A maximum of 1,000 points is given for each question. You will know your score on your device after each question, but the top 10 scorers after each question will be visible on this screen as well. As I said before, there are two types of questions, MCQs and one-word answers. And in MCQ, you have to choose the single best response. You may feel two answers are correct, but you have to see which is more appropriate for that given question. So only one answer would be correct at the end. No negative marking. How you join is I will show a barcode, and then you will be able to use that barcode to start your quiz. That barcode will be different for your trial run and different for your main quiz. Please enter your correct name when after the barcode you are prompted, because that is something very, very important. That's how we are going to identify the winners for the quiz. So with this, let's go through the rounds. There are in total 6 rounds that we've planned today. The first round is about history of endocrinology, where certain prominent figures in endocrine, scientists in endocrine who've done a lot of work, we'll base questions on that. The second one is a clinical round, and I'm aware that we have MD and DNB students, not only from medicine but pediatrics. So we've got a wide spectrum of cases, right from very small children to adults, so that it is covering both the subjects. So that will be a clinical round where you'll be shown a case, and then the question will be based around that. The third round is about laboratory investigations. You'll be shown some investigations with some relevant history, and your ability to interpret those investigations will be checked, and I'll be showing you an example shortly. The fourth round would be an image round, and in endocrinology we deal with a lot of images and a lot of scans, different types of scans. So there would be images based on clinical cases from those scans, and that would be the question. Round 5 is the only round in the entire quiz where it is not a multiple choice question. Here you will have to answer the question after typing. So that is what is going to be different. But nevertheless, we'll do the trial run, and we will be definitely trying this out during the trial run as well, how you're going to answer. But again, as I say, the time lag is very, very important. So that's how it is. And uh, the last round is the Bollywood round. So apart from endocrinology, we would be also very, very happy to also see, how you have endocrinology knowledge beyond the textbook. And that's what we would really take forward beyond endocrinology, talking about a few famous personalities that are very, very, well renowned, but they may have some endocrine problems. Some of the headlines that you may have seen with respect to endocrinology, that is what we're going to cover in round six. Now, in terms of the trial round, I thought I would run through the first three rounds and the fifth round. One question of each type we will run, and then we will, consider going to the main round. So with this brief introduction, let me get started. And this is the barcode that you're going to use for the trial round. You all can use this barcode and log in. Those who are not able to have a barcode from your phone, you can go to google.com, and then in there you type menti.com, and you'll be prompted as to where you have to enter the code, and you can enter the code. I suggest that after entering the code, you have to definitely, be able to see a thumbs up, and you can put a thumbs up, and that will figure up over here in the screen that you are seeing on Zoom. So I'll wait for 2 minutes for everybody to join. This is just a trial run, so don't worry. Let's see how many people have actually joined. So I think we can get started with the first question for the trial round. And this is the question. And the question would read like, a 37-year-old male patient presented with medullary thyroid cancer, bilateral pheochromocytoma, and primary hyperparathyroidism. You have to identify the skin lesion here. So I had given just one answer there. You should have been able to get the score on your screen. Let's move on to a second trial question. This is a story of a 14-year-old boy who has this thyroid dysfunction that you can see on the slide. The question would follow in the next slide. You have to tell me the diagnosis. There are 4 options given to you. Many of you have got the right answer. Let's see how the scores are. So when we do the main quiz, I request everybody to enter your correct name so that we can identify who is actually winning the quiz. If you do not have a correct name, I will not be able to help you with the prizes. So maybe I thought one round that we all need to practice. All the other rounds are similar as to the question that you had answered for TS Choma, but in one round you have to answer just a single word answer. Let's try that one. Round number 5 here, right? So this is just a trial round again. This is not the main quiz. All answers in this round are just a single word answer. Again, fastest fingers first. Right. So some people, many people, 64 people have answered this correctly. Let's see how the scores have changed. Right. So I think that's what I thought I'll show for the trial round. And we shall now move on to the main quiz, where we are going to take, the real quiz and all the rounds we'll go through. The whole idea in the trial round that I really wanted to share was that we are just going to have 2 types of questions. One would be an MCQ based question where we would just need a single best response, whereas the other type of question would be in which you have to enter a single one word answer. It could be in all small letters, it could be in all cap letters, both of that is accepted, but the spelling has to be correct, because if the spelling is not correct, you would not get marks for that question. So I think we are all set to get started with the main quiz for the year 2025 for our MD and DNB students in pediatrics and medicine on endocrinology, run by the Endocrine Society of India. So you would get a new link in terms of the Menti code that we started with. And so that will be given to you as we start the quiz. Maybe we'll give a 2-minute break and then we will start. For those who have not joined the trial run, don't worry, I will go through the rules again. We should be able to finish the quiz well within the time that we've given before 8 o'clock. Each round would have about 5 questions. Right, I think it's time to get started. So I'm sharing my screen now. And we are starting the main quiz for Endocrine Society of India for our MD, DNB, medicine and pediatric students in the field of endocrinology. Just trying to address one or two queries by some of the students, but yes, I think we are good to get started now. I think you should be able to see my screen now. Yes, so it's time to get started. We are starting with the main quiz. I'll go through the rules again for those who've not been able to attend the trial round. The rules are simple. What you need is this Zoom platform where you're watching me through, but you need another device which you can log in through either a barcode or a code that is flashed on the top of this slide. And every slide you will have this code which you can enter when you enter www.menti.com, and you can enter this quiz through any of the smart devices, even a laptop for that matter. The important thing to remember during the quiz is that you have to answer correct, but you also have to answer fast, because even very minimal time difference, even in terms of microseconds, your score can be very different from your counterpart. So you have to answer fast and you have to answer correct. Each question has a specified time limit. As I mentioned in the trial round, there are two types of questions. One is the MCQ based question, and the other is a question where you have to enter your answer, a single one word answer. Each question should be answered within the specified time limit. We've got 15 seconds to answer an MCQ question, whereas the 30-second time limit to answer the question wherein you have to type your answer. Those answering early and correct will definitely get more points. Once the time is lapsed, you cannot answer that question again. Even after you've attempted to answer the first question, you cannot change the answer back again. The maximum score that you can get out of each particular question is about 1,000 points. And as I said, two types of questions, MCQ and one word answer type of questions. Only one answer is correct. You have to choose the single best response. So there may be certain hints in the question which help you decide, even if you feel that two answers are close, which one is more appropriate. Only one answer is correct. The good thing is there is no negative marking. You can answer even if you don't know, if you want to take a guess, but there is no negative marking. To join, either you join through this code that you see on the top of this slide, and even if you get logged out anytime in between, you can join again later on by entering this code. And please ensure that you enter your correct name when you are prompted to get that when we move on to the quiz, because only with your correct name can I identify you if you are in the top 3 for the prize. As this information we've already shared before, there are 6 rounds that we have planned. We have planned the history round, the clinical round, the lab round, the image round. Round number 5 is the only round where you have to type in the answer, whereas all the other rounds you have to select one best answer. And round 6 is endocrinology, but beyond books. So round 1 is going to be talking about past history, prominent endocrinology personalities. Round 2 would be a clinic-based round, wherein a clinical case would be discussed and a question based around that. In round 3, a laboratory report would be predominantly discussed, and the question would be around that. In round 4, you will have an image. Need not be a CT, MRI. There are a lot of types of images that are used in endocrinology, and that is what will be asked. And in round 5, the question would have your answer in a single word, and you have to spell that word correctly, otherwise you do not get points. And the last round, as I said, is an MCQ based round, again talking about endocrinology but beyond the books. So let's get started with round 1, and this is the code that you all can join and can use for getting your score sheets. You have to punch in the answer through the device where you are using this barcode or planning to start through menti.com and entering your code. At this point, what you should be seeing on your screen is a green arrow mark saying you're all set. If you are clicking that thumbs up, that would be visible here. The color would be visible here on the screen. So let's get started with the first question of the first round. I'll wait for everybody to join. We had more than 150 people in the trial round, so I'll wait for 150 people to join here. If anytime during the quiz you get logged out, you can log in back using the same code which will be available on each slide. We have more than 160 participants today. I think the number is now stagnant. Let's get started with our first question of the first round. You should be able to see the question now. You can see the question on your screen as well. In 1849, so-and-so described a peculiar form of anemia in a lecture in South London Medical Society. He called it a fatal type of idiopathic anemia. Who is this gentleman? Glad most of you have answered this correctly. Let's see who are the top scorers. You'll be able to see your individual score on your screen as well. Congratulations to the top 10. You're very close. Anand, Krishnadev, Ajit Sinha. Well done. But others, not to lose hope. Each question here can make a huge difference. Let's look at our second question. You can see the question on your screen as well. This pathologist described the triad in the GI stromal tumors. Again, very glad that most of you have read and come for the quiz, are answering correctly. But let's see who are answering fast as well. Okay, so the top people have changed. They probably answered faster than the previous people. So Nidhi, Surya, John, well done. Let's move on to the third question. I can repeat that all of you can see your own personal score on your device. And it doesn't take long to reach the first 10. So all the best. Let's move on to our next question. This gentleman was awarded a Nobel Prize in thyroid. Who's he? Again, majority of you have answered this correctly. Let's see how the scores have changed. Nidhi is right now leading. Well done. Good luck to others as well. We're still on the round one. We are talking about previous personalities in endocrinology. We have 180 plus participants who are playing right now. I'm sure all of you identify this picture, but you have to identify the dog, the name of the dog. No, most of you got it wrong. This is Banting and Best, and Marjorie is the first dog, where they tried insulin. So a very important canine in the history of endocrinology. Let's see how this has changed the results now. So Nidhi is still leading, followed by Tamojit Desarkar, and third Anand, who was actually the fastest in this particular round. So well done, all of you. Let's move on to our round two. The first round was all about history and prominent people in endocrinology in the past. But second round is a more clinical round, wherein a clinical case would be discussed. You should be able to see the question on your screen as well. MCQ based diagnosis. Well done. Most of you have answered correctly. One of the sclerotic bone disease. The hint here is there is another person in the family and even in the neighborhood probably who may have this disease. Let's see how the results are changing. Right? Nidhi is still leading. Well done. Let's move on to the second question of the clinical round. And I'm sure you would have read about it. I'm sure some of you would have seen this kind of an eye. Okay, so we'll have to move on to the next question. An 18-year-old boy presented to the casualty with a hypertensive emergency. But you have to look at all the three images together. Brilliant. So pheochromocytoma with a thyroid specimen there. So yes, it is MEN2 syndrome. Let's look at our next question. What you see is a cross-sectional imaging, but you will get the history associated with this imaging in the next slide. 24-year-old male presents with abdominal pain and hypertension. The CT shows an incidental adrenal mass. What is your diagnosis? A large lesion that you see. Right. So fat is something that is seen as low density on the CT scan. So this is a hypointense kind of a lesion, hypodense lesion, and that is predominantly fat. Adrenal myeloma can be sometimes functional and they can present with hypertension also. 57 of you have answered this correctly. Let's see how the results have changed. Having consistent top three winners. And Repeat, you can see your own position on your phone as well. On question 10. 15-year-old boy, renal stones, hypogonadism, strong family history of the same. What is the skin lesion there? This is a collagenoma which is seen in patients with MEN1. As you would have read, MEN1 is parathyroid, pituitary, and pancreas. And this is a skin lesion called collagenoma, which is seen in almost all patients with MEN1. 57 of you have got this answer correct. Let's look at how has it changed the scores. Great. So let's move to our round three, which is going to be more of a laboratory-based round. And in this round, you have to again answer in a multiple choice question answer format. Let's look at the 5 questions in this round. So you already see the question. This is about a 4-year-old girl who's got a height of less than third percentile and a calcium which is 5.8, low, high phosphorus, a PTH value of 484 microgram per ml. You'll see this information again on the next slide with the question. What you have to do here is try and tell us the answer. What is your diagnosis? Glad the majority of you have answered it correctly. It is pseudohypoparathyroidism because despite having low calcium and high phosphorus, the PTH is high. So the PTH is not working. Well done. So let's look at the scores. Follow Me has come up to 4th position. Well done. Let's move on to the next question, the clinical question. And this is what the clinical history you're getting. A small child, a 1-year-old girl who's born to a consanguineous marriage. The ultrasound is not showing any Mullerian structures or gonads in the inguinal canal. You're looking at some hormonal values. And this is a lab-based round. So you're looking at these hormonal values, a low testosterone, a DHT value, and some ratios also mentioned, which will help you diagnose. You will have 4 options to answer. This information is available in the next slide as well, but we're looking at what is your diagnosis. Okay, so this question will get disqualified. None of you got it right. Actually, the answer was 17 beta HSD deficiency. But yes, we'll look into those 20 people who got that answer. The next question is again an image that you're looking at of an investigation. This is a flash glucose monitoring system. You're looking at glucose values at different times of the day. Based on this, the question would come in the next slide. You would be able to see this in the next slide as well. No, that also did not come across. But then the next question is talking about a lesion that you are seeing in the cellular region in the pituitary. You see that the prolactin was tested the first time and the value was 211 nanogram per ml. And the same test was done in dilution later on and the value is much higher. So you have to identify what is this phenomena that is happening in this particular patient. You should have 4 options on your screen. Wonderful. A lot of you have answered that correctly. Yes, it was a high dose hook effect, also called as the prozone phenomena that you would have studied in microbiology. Let's see how it has changed results. Right, Nidhi Anand Tamojit still leading. Akshay Hegde has come as to the 4th position. Let's move on to our next question. A 30-year-old male patient had a routine blood checkup, has a fasting glucose of 109, postprandial glucose of 136, A1C of 5.4%. I want the correct diagnosis. Only 25 of you have got it right. This is isolated impaired fasting glucose. So alone the fasting is high. That would be the more precise diagnosis. So again, we see change in scores here. As I said before, in MCQs, you have to choose the best possible answer. And nevertheless, the top 5 positions remain the same. So with this, we move on to the round 4, which is essentially an image-based round. Let's look at the questions in this round. And this is for the first question that you're going to see the image right away, also on your screen, and the question will follow in the next slide. So this is what the image that you are seeing that the question would be based on. Wonderful. All of you have answered that correctly. A lot of you have answered that correctly. Yes, it is a classic pituitary apoplexy. So Anand has taken over. Well done. Others not to lose hope. Follow me has come to the top 3. This is a bone scan that you're going to see in the next question as well. The question is based on this scan. Look at this bone scan, technetium labeled bone scan. Again, majority of you have answered bony metastasis is the correct answer. Majority of you have answered Paget's disease of the bone. Paget's disease of the bone would have sclerotic lesions, but predominantly skull will be involved. Here the skull is not involved at all. So this is changing the scores. And now we have Dr. Chaitandra Shaji on the top 3 list. This is a technetium scan. You can see the neck region. And this is what the next question is going to be based on, this particular scan. You should tell the diagnosis. Wonderful. A lot of you have answered that correctly. So yes, the answer is ectopic thyroid. This is actually in the tongue region. So this is the lingual thyroid that you're seeing here. So again, the top 3 are now changing. So giving hope to all of you that, the scores can change remarkably. And so please don't lose hope and keep answering. This is an MIBG scan study, which has been done for over a week. MIBG scan is again another kind of a nuclear medicine scan that is often done in endocrinology. The question is based on this particular scan. Again, you have to tell the diagnosis. The scan should be visible on your screen during the question as well. So paragangliomas don't happen in the liver. If you've read your anatomy about the distribution of the sympathetic and the parasympathetic ganglia, it is more towards the core central region. In this particular case, there was uptake in the vesical region, the urinary bladder. Then what you saw in the liver was a normal uptake of the scan. So yes, a tricky question, I would say. Let's see how it has impacted the scores. Okay, still 5 out of the top 10 have answered it correctly. And it has changed the top 3 again. Let's move on to our next image. And in this image, you see again an image, a lateral scan of the sella region. An arrow has been placed to make life a bit easy to see what the diagnosis is going to be. The question is based on this image. You should have the options now. Lovely. Most of you have got the answer correct. Well done. Almost everybody in the top 10 have answered that correctly. Anand has answered fastest, and Anand is now leading the top score at the score of 10,731. So friends, this is going to be the next and the last image question that you're going to see. The question will follow, but I'm showing it here for better clarity. 8-year-old boy, born of a non-consanguineous marriage, multiple large hyperpigmented patches, that is a hint, and the X-ray that you see. You'll be able to still see all this information on the next slide, but you have to tell the diagnosis. Put all the things together to get to the diagnosis of this case. Wonderful. Very, very impressive. I'm really impressed by the knowledge of this group, the effort that you put in to come, study, and prepare for this quiz. So well done. Let's see how this changes the score. Glad that all the top 10 have answered this correctly. And Anand, John, and Sita are the top 3 scorers for this so far. So with this, I think we now move on to our round 5. Now, as I mentioned before, round 5 is going to be a bit different as compared to the earlier rounds, wherein here there are no MCQ questions. Here you have to type your answer. You have to answer it as a single word, no spaces in between. You can either type everything in caps or everything in small letters with just a one-word answer. The spelling has to be correct. Let's look as to how you do in these next 5 questions. One-word answer. You have more time than usual. 88 people have already answered. 100 people have already answered. Brilliant. You still have another 10 seconds to go. So as I said, the spelling is very, very important. 81 people have got it correctly. It was a single word answer. Dopamine agonist, 9 of you answered, but that's a broad answer. Single word would be cabergoline. I'm glad that many of you have answered. Let's see how it's changing the score. Okay, it didn't show us. It will come to us in the next question. Let's look at the next question now. Nevertheless, you can see the scores at the end on your screen. You have a patient who's got cortisol insufficiency and hypothyroidism. Which hormone would you replace first? You have to type the answer. Single word answer. Which hormone should be replaced first? Couple of right options. Hydrocortisone has got answer. It asks for the hormone. The best answer would be cortisol that 112 of you have responded to. But yes, a few of you have got okay with some other answers as well. Let's see how the results have changed. So most of you in the top 10 have answered it correctly, but whether it's going to change the top three, yes, it will. And as you can see, the results are very dynamic. They keep changing with every question. So not to lose hope. You have to name the drug. Right? 72 of you have got this correct. Let's see how the score changes. Right? There's a tough competition which is going on in the top 10. Wish you all the best. Let's move on to our next question. You can see the question on your screen. Name the drug. Spelling is important. 101 of you have got that correct. As you see, each question is important. It does change the score remarkably. Yes, so Anand is leading the scoreboard now with 1,496 points. So friends, with this, we move on to the last round of ours. And in the last round, you see this picture of Messi. I'm sure all of you have seen him play football. You have to tell me which hormone is essentially associated with him, his treatment, and overall a big hope to people who've, had problems with that hormone. Right? So all of you are watching the news as well. Well done. Yes, growth hormone deficiency. Wonderful to see how growth hormone deficiency, if treated well, can bring you a lot of laurels. So as you see, the top three are changing. Anurag is now leading the scoreboard. We have 4 more questions to go. The next question is on this particular movie that you see here, and the question should be visible on your screen right away. Which disorder is reflected in this movie? Right, 100 of you have answered that correctly. Yes, everybody in the top 10 have answered that correctly. Let's move on to our next question. Again, you see this movie. The question is based on this movie. Choose the best response. Okay, majority of you are watching movies as well, which is good. So the last few questions, the top 10 are answering all the questions correctly. Tough competition on there. Let's move on to our next question. This is based on this movie called The Greenland. Second last question of the day. To answer fast, so even if you Google, you won't be able to make it fast. Yes, majority of you know it's type 1 diabetes. Let's see the scoreboard. Each question is important. Anurag, Sita, and John are currently leading. Let's see what happens in the next question. Sure, you can all identify him. Let's see what the question is. The last question for today. Right, majority of you have got it right. With this, we come to an end of our quiz today. Let's look at the top 3 winners for today's quiz based on your score throughout the performance. Very close, I would say. Big round of congratulations to Anurag, followed by John, followed by J. Krishna J. And we will contact you individually. But thank you again for joining today and taking part in this year's Endocrine Society of India annual quiz for uh, MD and DNB medicine and pediatric students across the country. And I'm sure we will come back again next year with an even more exciting quiz uh, for all of you. So we will intimate individually the prizes. We have the list of names and the contact details. I hope you've entered your name correctly. Those who have lost, nevertheless, you have tried well. Definitely, the idea of the quiz is to encourage your reading with respect to endocrinology and to show the diversity of the subject. So with this, I will take leave. Thank you so much for joining in and participating in this quiz today. Thank you so much. Bye-bye. Arifa, can you hear me?
Yes, sir.
हाँ जी, बस पूछना था कि बीच में कोई कमेंट्स आ रहे थे क्या आपको कोई कहीं पे या नहीं? कोई मैसेजेस या कमेंट्स ऑडियंस की
सर ये
तरफ से क्या?
हाँ
नहीं,
सर, हाँ सर, आ गए सर। आ गए
कमेंट्स
लेकिन हाँ, यूट्यूब लाइव में है क्या सर?
नहीं नहीं, यूट्यूब लाइव नहीं। अच्छा, यूट्यूब लाइव में आ रहे हैं कमेंट्स।
वो तो एक्सेस पशी सर के पास है सर।
ओके, श्योर श्योर, अगर कोई कमेंट्स आए तो मुझे भेज दीजिए, ताकि उसमें
ठीक
अगर
है
कोई
सर,
चेंज
मांगेंगे
करना
सर।
है, हाँ जी,
ठीक
उनको
है
बोल
सर,
दीजिए।
ओके।
ठीक है,
ठीक
थैंक यू
है
सो
सर।
मच, थैंक यू, बाय
थैंक यू
बाय।
सो मच सर।